How can Lupron be used in so many different ways? I'm Dr. Jessica Reinick, a double board certified OBGYN and reproductive endocrinology and infertility specialist. Now I'm going to talk about the magic of Lupron today. In order to understand why we can use Lupron in so many different ways, we have to go back to the menstrual cycle. But we have to understand a little bit more about it in order to understand Lupron's effect. These hormones we've been looking at have been the communication between the brain and the ovaries. But there's a little bit more to it in that the brain has two different compartments that we're looking at, and those are the hypothalamus and the pituitary. So the hypothalamus stimulates the pituitary with a hormone called GnRH, or gonadotropin releasing hormone. That communicates between the hypothalamus to the pituitary, and then the pituitary is going to release the gonadotropins. And do you know what the gonadotropin hormones are? I bet you guessed it, FSH and LH, or follicle stimulating hormone and luteinizing hormone. And then we know what those hormones do. They come down to the ovaries, and then the ovaries begin to produce estrogen. Estrogen then goes back up to the pituitary and back up to the hypothalamus, and it turns these hormones off. It's called negative feedback. Okay, now that we got that out of the way, we can talk about Lupron. So I'm going to talk about short-term and long-term effects of Lupron so that you can understand why we can use it in so many different ways. So Lupron is a GnRH analog, meaning it looks a lot like GnRH to the body, which means that if you have Lupron in the short term, it's going to go down to the pituitary, and then the pituitary is going to release a lot of FSH and LH. These are still then going to have their normal action and go down to the ovaries, which will release estrogen. This action is essentially a flare of your gonadotropin hormones, and we use Lupron in this way in a couple of different instances. So you may have heard of the Lupron flare protocol, where Lupron is started at the beginning of the cycle so that your own body releases FSH and LH to stimulate the ovaries. Or we can use it as the trigger shot, where if you haven't used Lupron earlier in the cycle, you use Lupron, you get this flare of LH and FSH, and then that leads to ovulation because LH is the ovulatory hormone. So what about the long term? So if Lupron is there for a long time, it just sits on those receptors and the pituitary becomes desensitized to Lupron or GnRH because it's seeing so much Lupron that it doesn't really care that it's trying to be stimulated. And what that means is that you're going to have less FSH and LH produced, and then it is going to not stimulate the ovaries. So when taken for a long time, the Lupron is suppressive to the ovaries. And that is why in the Lupron flare, after it has that initial flare, it becomes suppressive, and it can be your suppressive medication. It's also why it can be used to suppress your hormones in something like endometriosis and be used for a long time prior to a transfer protocol to suppress your body if you want to be doing replacement hormones. It's also why if you're using a medication like Lupron earlier in the cycle, you can't use a Lupron trigger because you won't have that flare because the pituitary is desensitized and doesn't care. I know it's confusing, but hopefully that makes sense, or at least helps you understand why Lupron can be used in the short term to stimulate or in the long term to suppress the body's communication when it comes to the menstrual cycle.